I think every person in this room, Amedy, we were speaking about this earlier, has a story that brings them here today, right? Everyone is here for a reason, and we do what we do because of you and everyone here. Mm-hmm. We are so grateful that you wanted to come join us today, that you wanted to tell your story.
Yes.
And it's just incredible to see what you've done in the advocacy space and how you tell that story. Where do you want to begin?
Well, I'd like to say I'm definitely not a New Yorker. I am from Michigan, born and raised, country girl all the way. My family and also me, we're very avid hunters. Deer, anything, muskrat, you name it, we've done it.
Nice.
And so I grew up, knowing guns can be used for sport, but also for, other dangerous things. And I was taught that at a very young age. My parents informed me of that. And I feel like nowadays less and less is that is happening. That either, one or the other is not educated or they don't quite know how to go about it. But yes, I am a survivor of a gunshot. Sadly, my stepdad suffered from a lot of mental illnesses, and we were aware of the illnesses, but he was not getting the proper help that he needed. And so an incident happened, and he completely snapped. And he drove 2.5 hours in Michigan down south to go pick my mother and I up from the Grand Rapids Airport from our cruise. It was my 18th birthday cruise. And he had the gun out, and he got me first, and I passed out, and he thought, I passed out. So he thought he got me, and then he shot my mother, and then he killed himself. And when I came to, my vision was pure black and my ears were ringing. I had no idea what was going on. So there's two things in my mind, like, there's no way I'm going to die. I'm freshly 18. Day before. I'm not going to die. No. I got my whole life ahead of me. And I need to get help. Help, hello. So I try to do the lights. I try to do the horn. We're on the side of a very busy highway, I-96, in Grand Rapids, and I'm like, no one can hear me. And so I get out of the car. I lost lots of blood, but I was still moving from the shock and adrenaline, and I kept going. I literally didn't stop until a semi almost hit me. I was so close to the highway, just trying to get help. I was told that 3 people called in. One semi-truck driver saw me because I was trying to wave people down. My mother and stepfather were in the view. After I couldn't fight anymore, I laid back down and I told myself, this is how I'm going to die. At 18, that's how I thought I was going to go. And I was sad and heartbroken. And I didn't want it to end. I want to keep fighting. But I passed out. And, eventually the cops came, everybody. And I was sent to Hofstra Hospital. But, yes, and now I have really good care. My doctors are amazing. I definitely want to do a shout out to my reconstructive surgeons. My first one, Richard Buckman, amazing man, phenomenal. Christian Berkler, them two both work at U of M. They are both amazing doctors. And then, of course, David Hirsch. Yep. I have the pleasure of working with him, and he is amazing.
I believe Dr. Hirsch is here.
Is he? Please stand up. Please. Yes.
Was it? Oh, perfect. Thank you. And just for background, so Dr. Hirsch and Dr. Brett
Oh, yes, but I
yes,
apologize.
and he's actually not here, but he wishes he was. You know, he had some other conflicts, but they're part of an organization called Next Gen Face that actually really provides this care and supports patients through this journey. So I know you were very close with them.
Yes, and if I still had my sight today, I'd still be out in those woods. I'd still have that 12 gauge right next to me. It's not the gun, I'm not afraid of the gun. It is. I believe the person behind it is the one that hurt me, because you can have it stand up, unloaded, safety on. It's not going to hurt a thing. I mean, it might knock over, but why was it loaded to begin with if it were to go off? And so I asked myself those questions, or why do you feel it's necessary to have a gun loaded next to your bed with the safety off, especially with children around? If you have children, those need to be locked up. I mean, like we've been saying this whole day. I mean, that I have 2 nephews and 2 nieces, and if I were to lose them, I don't know what I'd do. And just thinking that that's the highest rate. My niece is first year going to school this year, and I'm so scared. I'm scared, and she's just my niece. She's my niece. But yes, mental health really needs to, like I was saying with my stepfather, he had a lot of mental illnesses that doctors, I don't know, but it just really wasn't brought up. And I believe that if he were to get that help, that everything's would have, maybe this wouldn't have happened, maybe it would have. But yeah,
in this world, we talked about it a little bit. You heard Michael Dowling mention this as well. Mm-hmm. Things like kindness and positivity are often lacking. And you've somehow maintained just this incredible energy and positivity. What drives you?
Honestly, I'm a very stubborn woman. I am very stubborn. And so when someone tells me you can't, I look at them and say, watch me, I will. And so my mother, you don't stop. No, you fall down, you get right back up. Don't get right back up. That's what my dad taught me too. Wow. You fall down, it's all right, sweetheart, get back up. You can try again. Keep trying.
Wow.
That's what I do. And from this incident, it has gained a passion for me to go into psychology so that I can, be a voice for that as well in that department. Because like I said, the mental health in America, I feel is not getting addressed as it should be. Because if you look at all these stories, these school shootings, and, all in general, it's either about, like we were talking about, race, religion, but the mental health aspect, I feel that, if you want a gun, background check, mental evaluation, if you have a domestic, violence or sexual, anything like that, I personally, that all should be checked and, looked at when you are getting a firearm. Mm-hmm.
And you brought up too that I know in Michigan in particular, there's been a big push by the governor to focus on red flag laws or extreme risk protection laws.
Yes.
You want to talk a little bit about that?
Yes. I was actually very happy when she brought that law out. I don't remember when, but there was an incident back in 2015. I was 15 years old, and my stepfather showed some aggression. Okay, not some. He showed aggression, and I feel if that law was in effect, then I could have went to the police and all of the firearms would have got taken out of the house. Wow. I personally, I feel like that, I wish that law was in effect a lot earlier, but it's in effect now, and I'm so grateful for that. And I just hope that people, when they do see the signs, that they will speak out. And it is hard. It's not easy. The backlash is really difficult. But yeah, no, you just got to keep pushing forward. You keep pushing forward, and eventually someone will hear you, and then something will get done.
Have you felt that backlash yourself?
Yes.
Yeah.
Yeah.
I know you talked about that. You know, a lot of the folks in the room here have been instrumental in really pushing forward kind of those red flag laws, and I think this is the true impact that you can see that could potentially prevent, right, through that law. So it's amazing to see that momentum.
Yes.
You mentioned you're really excited to be here to talk to a room full of folks who are immensely passionate about this issue, but also have a healthcare lens to it.
Yes.
Why is that so important?
Well, because I feel if my stepdad would have got the proper help, that he wouldn't have suffered the way he did, and he wouldn't have snapped the way he did. He had a lot of mental things that he needed to get addressed, and they were ignored. But that also, you know, that by, you know, that's also on him, you know, but also, you know, as a family, we should have saw that as well. So also, you know, families need to be aware, you know, someone's having a bad day or, you know, something, just, I don't know.
Yeah.
I stay positive for other people. I don't like seeing people sad.
Yeah.
No.
Yeah, I read that there was a story that you had where you ran into a young kid in the bathroom, right?
Oh, yes.
You wanted to share that?
Yes. So, you know, I love children. I don't have any of my own yet, but I do. I love them. And yes, my aunt and I, she was taking me to Ann Arbor for one of my appointments. And we're in the bathroom, and this little girl, it's always the same question. Why don't you have an eye? And so she was in the restroom, and she was like, Grandma, why doesn't she have an eye? And I'm outside and wash my hands. I'm just smirking to myself. And she goes, I don't know. Why don't you ask her? And that made me happy, because I've noticed also in the last 7 years, a lot of parents try and shun their children. Shush the children. And it's like, no, that's curiosity, you know, it's curiosity in a kid. And so she came up to me and, you know, goes, you know, why don't you have an eye? And so I told her, I go, you know, a man hurt me, but it's okay. He's gone. Can't hurt anybody else. Okay. And then she was like, you know, blink or wink or something like that. And so I just kind of blinked. And then she goes, no, the other side, and points at my left. And I just start laughing so hard. I was like, oh, little girl, you are so cute. I was like, honey, I can't. I was like, I don't have an eye. And she looks at me and goes, I know, and starts laughing. I was like, oh, children, I love you. Like, honestly, it's the children that, oh my gosh, you know, like I'll be with my best friend and her daughters, you know, we'll be going to the park, and I just get children all around me, you know, and I love it. Because, you know, their positivity, their energy, their spunk is what I, you know, try and portray out too, and just the happiness and joy of life. It makes me really happy.
Yeah. I know. It's beautifully said, and you know, I know when many of us see kids in the trauma bay, and you see what their families are going through, it's you just say why, you know?
Yeah.
Why? So, given all you've done, right, and you've done a lot in the advocacy space, you know, you've been a voice of support for so many. What do you see as, you talked about some of the solutions, so we talked about safe storage, right, crisis support, red flag laws. What do you think is going to get us to the next level of really putting those things into place and changing the gun violence epidemic in this country?
Education. Education, awareness, knowing.
Yeah.
You stumped me.
I stumped. Oh, okay, good.
Yeah,
good,
you stumped me.
Well, I
do
think you
that.
covered so much of it already, right? I mean, you highlighted so many solutions, right? This is a entire room full of supporters, and we're all one family now.
Yes.
You know, just in the last 3 minutes, right? What are some of your parting thoughts? What would you like folks here to walk away with after this day?
Well, just, I mean, when you set your mind to something, you know, you can do it and never give up. There's always hope. There's always light at the end. There's always light at the end of that tunnel. There always is. Even when you think there isn't. And sometimes, you know, the dark days can be dark. But, you know, them good days, though, like when I get back home, I'm going to go see my niece. She's going to run up and give me a big old hug, you know, and it's moments like that that make the hard days just a little better. So never give up. Never, ever, ever give up.
That's right.
Thank you so much, Amedy.
Thank you.
You know, we can't wait to continue the work collectively, and I think we're all tremendously inspired. So thank you so much.
Thank you.